weight loss is the typical goal if you take Wegovy or some other type of GLP-1 medication. But in some cases, people report shedding more than just pounds. They also seem to be losing hair, clumps and clumps of hair, judging by online photos. That brings up an obvious question. Is this normal? That's what we're going to chat about today with endocrinologist Kathy Zhou. She is one of the many experts at Cleveland Clinic who visit our weekly podcast to help you better understand medicine and how it works. So with that, let's find out whether a medication driving weight loss could also lead to you testing new hairstyles. Welcome back to the podcast, Dr. Zhou. It's always nice to see a familiar face.
So nice to be here as always. So thanks for having me again.
You're here to talk about GLP-1 medications, and these are becoming so much more commonly used for weight loss. And it seems like we're hearing more and more about people using them, and then some side effects that kind of come about too. And one of those is hair loss. Now, I know hair loss isn't listed as an official side effect of GLP-1s by the FDA, but if you go search around online for a little bit, you'll see that it is an issue for folks. It's even been dubbed Ozempic hair.
Yeah.
So which is it? Is it not a problem, or is it something that you see?
Is unfortunately something that we see. The official name for it is Telogen effluvium. And I'm sure my dermatology colleagues will take me to task for some of that pronunciation.
I understand why they call it Ozempic hair, though. That other one's a mouthful.
Yeah, we can stick with Ozempic hair. Fair. So, it is a real concern and consideration that we see in the clinic. I certainly have had a fair share of individuals come back complaining that all of a sudden they're losing hair. And what we need to know is that, weight loss in particular can be a stress actually on the body. The body perceives it as stress because we were kind of more made for abundance and plenty, times of plenty. And so what can happen in the months following some of this initial weight loss is you go into a period of kind of excessive hair loss. And so what happens in this condition is that hair kind of has these three phases. We call it grow, kind of this quiet phase or stable phase, and then this loss phase. And most hair is kind of in the grow phase. But what happens when the body experiences a stressor is more of that hair is pushed into that quiet phase, which precedes a loss phase about a couple months later. And so you see this sudden shift of more of your hair into that sort of quiet and then loss phase a couple of months down the line. So that is certainly, again, something we see in the clinic. I will offer that some of the nutrient deficiencies that unfortunately we see when people are becoming malnourished or not being intentional with their eating on the GLPs can contribute, in particular protein deficiencies. So if a person isn't hitting their protein intake on these GLPs, we can see some also excessive hair loss from a nutrient deficiency on the medication.
Yeah. Is this, so when your body kind of has this stress and it affects kind of that hair cycle, is that just your body kind of making sure it holds on to some resources? So it's like, hair is kind of maybe not the most important thing.
You hit the nail on the head. That's exactly right. The body is going to protect your heart, your kidneys, your liver, before it's going to give you a nice head of hair. So what we definitely see that shifting in some ways of resources towards the vital organs.
Which makes sense. I mean, you do, while everyone loves their head of hair, I mean, heart might be a little more important.
Yes, I would strongly argue that the body does a good thing in protecting the heart over the hair, All
right. So we kind of have this stress as you drop some pounds. You had mentioned nutritional deficiencies, and that's a byproduct of just when you start taking this medication, you typically eat a little less, correct?
Correct. And sometimes people take it to an extreme, right? They're eating a lot less, really not hitting enough calories to meet all of their nutrient demands for the day. And that's, again, when you're adding kind of insult to injury. Not only are you losing a lot of weight and going into calorie deficit, which, again, the body can perceive as a stress when it comes to hair, but now you're not even providing the resources to generate new hair, so yeah.
What about hormonal changes? Because I know, when you're taking these GLP-1s, there's obviously some hormonal things happening.
Yeah.
Does that play a role in it too?
I would say probably to a lesser degree than the issues we just covered about nutrition, and then just, again, the stressor of weight loss itself. Certainly, I have a lot of patients on thyroid medication, and if you lose a lot of weight, it turns out that your dose of thyroid medication actually has to change. And so if it's kind of indirectly impacting other hormonal stability in that way, you could see further hair loss, layered on top of the GLP use.
Well, and I guess that's the thing to emphasize here, like this sort of hair loss with rapid weight loss is something that happens. It could happen with this medication, but it could happen with anything where you're dropping pounds quickly.
That is exactly right. So it's really not, it does not appear to be just something tied to the molecule itself, at least not to our knowledge at this time, but rather derived from just, again, what it does to potentiate that rapid weight loss.
Yeah, it's not the medication itself. It's what the medication's causing that's then leading to this.
Precisely.
All right. Well, now the big question. Is hair loss from GLP-1s permanent, or is it something where it's gonna start growing back eventually?
So luckily, it's usually not permanent, but it can take months. I remind patients that we're talking about hair goes in about these 3-month cycles, and so after it experiences the stress, 3-month lag, it sheds. You could be waiting 3 to 6 months for things to stabilize and go back into a growth cycle. And what you want to be doing during that time is promoting, having all the nutrients needed for a future growth cycle of hair, And also you do probably want to get screened for any other causes of hair loss. Iron deficiency, I did mention the thyroid already. That's one that we see that could be contributing to further hair loss.
And when we say hair loss, are we talking a little bit, or can it be pretty extreme?
So the quote unquote Ozempic hair, or the telogen effluvium, is literally clumps of hair.
Okay.
Like, the classic picture of like someone's holding, a ball of hair in their hand, where
Yeah.
it's coming out onto their pillow with no kind of stress on the hair follicle. So it's significant. This isn't the little bit of strands, that we lose in the shower every day. This is on a different level for sure.
So it's one of those things. It sounds like it's going to be a little noticeable maybe at the start when people experience it.
It certainly can be. People, the common refrain is, "I feel like I'm losing all my hair," even if it maybe isn't entirely accurate, but certainly people notice thinning. You can see kind of a little more of the scalp. Maybe a couple areas are more noticeable. That there's been some receding of the hair line.
Yeah, and that can be pretty distressing, which isn't going to help with the stress response, which is adding to the hair loss. So,
yeah, it's probably not, and it certainly is very distressing for a lot of patients of mine. But again, it's just remembering that this is temporary, and again, like everything, it's a benefit, side effect, risk analysis, and in terms of what the medication's doing otherwise.
is there a way to avoid this? I know it's temporary and it'll grow back, but you'd rather not have to go through it. So, are there ways to kind of prevent it or really limit it?
Yeah, so we don't want you to be losing weight. Again, I've talked before about this kind of cliff effect, where like someone's just losing weight so rapidly that just when you look at their weight graph, it looks like they kind of fell off a cliff.
Yeah.
So you do want it to be kind of a more steady weight loss, emphasizing, again, nutrient-dense foods and products, and in that way you have your best shot at mitigating this. But to a certain extent, it may not be avoidable in certain individuals. if they're losing weight.
Do you ever, I mean, do people take like supplements where if you're worried about maybe those nutritional deficiencies, like maybe
They
that will help?
could, but it's only if there's pretty clear evidence that there is probably some degree of an underlying nutrition deficiency, that we really start pushing different types of supplements. There's not a ton of evidence that things like biotin, for example, help in this situation, even though we sometimes might recommend it to people. There are certain, treatments, minoxidil, steroids that have sometimes been used in this situation, but they would only apply not so much as a preventative measure, but rather kind of a treatment on the tail end, unfortunately, after it's already developed.
Are there, I mean, I'm sure if you go online, there are plenty of special shampoos or conditioners or
Yeah,
things like that. Are those worth the money, or will they help?
they might. I think success rates are somewhat attenuated in my personal experience in the clinic, but clinically they may help. And I do often in these cases will involve my dermatology colleagues if things are really getting very out of hand or this particularly distressing to the patient and they still want to continue on the medication. I may refer them to derm for a full, care consult, so to speak.
And then it sounds like there might be some options that they have when you go that route, but that's if
Correct.
it really gets into a bad, you're really seeing some extreme loss.
Correct. They have a few more tools in their toolkit, to try and address this as well.
How likely is it that you might see hair loss if you start taking GLP-1s?
It's unclear to me if the data exists, like specific percentages, but it's fairly common, just anecdotally in my clinic, probably, fourth to a third of the patients describe some degree of hair loss, like just voluntarily to me without even being asked, which means it's probably somewhat significant, to them in their day to day.
So most people are pretty attached to their hair. I mean, we all spend our time in the morning getting it just so. So when you talk to your patients and you're kind of walking them through what might happen when they start taking a GLP-1, how do you kind of present this so they can be prepared and maybe weigh whether or not it's worth that?
Yeah, it sort of depends. I think I spend more of my time talking about the lifestyle adjustments that they need to be thinking about that also are going to potentially attenuate any of the hair loss. I do mention it often as a potential side effect, in particular if our patients are already kind of concerned about hair loss at the get-go. I'll say, this probably isn't going to help you very much in terms of preventing further hair loss. In fact, it may worsen the situation. But again, I tend to spend more of my time talking about, nutrient dense foods, trying to make sure you're well hydrated, really just fueling the body appropriately and not losing, just ridiculous amounts of weight out the gate by starving, essentially yourself.
Yeah, it sounds like a lot of it, there are things you can do to maybe help the cause, make sure those flowing locks stay a little bit. But just, it's a matter of working with your, healthcare provider and just really trying to get a solid plan in there.
Precisely, precisely. It may not, again, like I mentioned earlier, be fully preventable, but there are things that you can do to try and turn the tide in your favor.
And as we've talked about before, when it comes to GLP-1s, there are so many benefits to them as far as what they do for your overall health. You might just have to go a few months with your hair not looking the best, knowing that in the future you're going to be healthier and maybe a more vibrant person.
And I find that that is a trade-off many people are willing to make.
That sounds like a perfect spot to end, and I feel like I need to go and check my hair.
You and I both, right?
Dr. Zhou, thank you again for coming in, and it is always a pleasure talking with you.
No, so nice to be here again. Thanks so much for your time.
Hair loss is a possible side effect that comes with taking a GLP-1 medication. It's connected to rapid weight loss, not the medication, and can last for months. Talk to your healthcare provider about your options when it comes to keeping your head of hair intact. If you liked what you heard today, please hit the subscribe button and leave a comment to share your thoughts. Till next time, be well.